Good evening. Tonight we will discuss the creepy side of AI in healthcare. Imagine this: a physician sits down at the end of a busy shift, trusting an AI transcription tool to document her patient interactions accurately. But if she reads over the AI generated notes, she is horrified to see phrases like patient diagnosed with advanced heart failure, where she discussed only mild symptoms. Another note claims the patient's family expressed concerns about violent tendencies, a baseless invention that appeared out of thin air. This isn't a horror story, it's the reality of AI hallucinations, a term used by AI whenever it fills in gaps in understanding with incorrect information, often with potentially severe consequences. AI transcription tools like OpenAI's Whisper have been found to hallucinate troubling and incorrect details during transcription. In one study, these hallucinations occurred in around 1.4% of cases, and almost 40% of these errors were classified as harmful, meaning they included invented, violent, or alarming language that was never spoken by the physician or the patient. Some errors arose simply from pauses in speech, leading to AI to fabricate inappropriate words or phrases to fill in the silence. Imagine the risk if these hallucinations were mistaken as real patient data or clinical notes used in diagnosis or legal proceedings. Misinterpretations have occurred even more frequently when transcribing speech from patients with speech impairments, such as aphasia, exacerbating risk for vulnerable populations. AI's overconfidence in its own facts poses a hidden danger to patients and medical staff alike. Physicians using AI scribes are advised to meticulously review all AI generated notes to catch errors before they become part of a patient's permanent record. Yet, this burden conflicts with the purpose of saving time. Not only does this issue highlight a technical flaw, but it also raises ethical concerns about the accountability of AI in healthcare providers, as inaccuracy in medical records can lead to lawsuits and serious harm to patients. In healthcare, AI hallucinations underscore the double edged sword of this technology. While it can reduce administrative load, its missteps could fuel dangerous inaccuracies if unchecked. Until robust error prevention measures are established, AI is helpful, but sometimes sometimes a haunted assistant in need of constant human oversight. AI's role in healthcare offers incredible potential, but its missteps have sometimes caused harm, raising critical questions about patient safety and oversight. Here are some real stories where AI had unintended and at times dangerous impacts on patient care. Diagnosis gone wrong in radiology. In radiology, AI has been used to scan images for abnormalities faster than human physicians. However, in cases where AI was trained on limited data sets, it struggled to recognize variations in disease presentations. This was seen when AI failed to identify certain types of cancerous tumors, leading to misdiagnoses that delayed crucial treatment. Radiologists have voiced concerns over black box decision making, where AI's reasoning remains opaque, making it difficult to identify and correct errors before they reach the patient. Another example is predictive analytics and unanticipated outcomes. AI driven predictive models intended to manage patient flow and anticipate demand sometimes misjudge which patients were at higher risk. For instance, in one case, an AI tool prioritized resources for patients it deemed to have a higher hospitalization risk based on outdated data, missing those with newer or less common conditions. This misalignment meant that critically ill patients were sometimes overlooked, while others received unnecessary interventions. This misclassification stemmed from AI's inability to adapt to evolving healthcare data, highlighting the need for continuous updates and monitoring. Third, ethics of autonomous decision making. AI is used in mental health. AI used in mental health chatbots offers accessible support but has been found to be insensitive to critical nuances. These chatbots trained on general data sometimes fail to recognize emergency phrases such as indications of suicidal thoughts, leading to responses that were generic or worse, inappropriate. A recent tragic case has highlighted the dangers of using chatbots as emotional supports. A 14-year-old Sewell Setzer committed suicide after he took out his phone and messaged the chatbot that it had become his closest friend. Sadly, this incident emphasizes the broader risk associated with AI chatbots in mental health, particularly for young people and vulnerable users who may turn to AI for companionship and advice. Such reliance can blur the line between reality and artificial intelligence, sometimes leading to dependency, unhealthy attachments, or even tragic outcomes in cases where the AI's language misleads or exacerbates distress. To make AI in healthcare less intimidating, healthcare workers and patients can focus on accessible ways to build familiarity, promote transparency, and establish trust with technology. Here are some suggestions. Education and transparency. Healthcare institutions can offer workshops or educational sessions on how AI tools work in patient care, from diagnostics to transcription. When patients understand the how and why behind AI, they often feel more in control and less fearful. We can also implement human to AI collaboration. Emphasize that AI tools are here to assist, not replace healthcare professionals. By involving patients in the decision-making process, especially when AI tools are used, the patient sees AI as an additional supportive resource rather than a potential barrier. Personalized AI use in care settings. Encourage caregivers to personalize AI applications for different patient needs. For instance, using AI to automate routine tasks like scheduling follow-ups or reminding patients of medications can be a gentle introduction, showing AI's practical benefits in non-evasive ways. Design with empathy. Integrate more human-like elements such as reassuring phrases or empathetic prompts into AI-powered applications. For example, chatbots that offer health advice can be programmed to use compassionate language, reinforcing that they're here to help, not diagnose independently. Encourage feedback and communication. Allow patients and staff to provide feedback on AI interactions. A system that encourages and responds to concerns or suggestions can build a sense of collaboration, making AI feel like a partner in the healthcare process. If you're a healthcare worker or patient who wants to ensure accuracy in medical records, here's a step-by-step approach to help you know and challenge any discrepancies effectively. Right. So if you, as a patient or a caregiver, notice that there is a mistake in a medical record, one of your first actions is to request access to all of your records. Start by requesting a copy of your complete medical record from your healthcare provider. Most clinics and hospitals allow patients to access their records online through a secure portal, or you can request a paper copy if preferred. Review regularly. Make it a habit to review your record after every major appointment, procedure, or hospital stay. Look for notes, lab results, and summaries of diagnoses and treatments. This way you can catch and address any inaccuracies sooner rather than later. Understand the terminology. Medical records use technical terms that can be complex. Don't hesitate to ask your healthcare provider for clarification on any terms or findings you don't understand. Having a clear understanding will help you recognize potential inaccuracies. Identify and document errors. If you notice an error, whether it's incorrect information about a diagnosis, medication, or procedure, note it down along with any relevant dates and details. Accurate documentation will strengthen your case when requesting a correction. Submit a correction request. Contact the healthcare provider's record department to formally request a correction. Many institutions require a written request detailing the error and to correct the information, as well as supporting evidence such as lab results or physician's notes. Confirm that the corrections were made. After submitting a correction request, follow up to ensure that the necessary updates were applied. Ask for confirmation in writing so you have a record of the corrections for future reference. Engage in patient advocacy resources. If your correction request is ignored or denied, consider reaching out to a patient advocate or healthcare ombudsman. These resources can provide support and sometimes expedite the process to resolve record discrepancies. Taking these steps encourages a proactive approach to medical record accuracy, empowering patients and supporting healthcare providers and delivering the best care possible. Let's make AI less scary for all. We're now going to go forward with our practice review. Question number 1. What was one of the first major concerns raised when AI began to be used in healthcare? A, AI's ability to replace nurses. B, AI making decisions without human oversight. C, AI reducing the cost of healthcare. Or D, AI eliminating the need for medical education. The correct response is B, AI making decisions without human oversight. The rationale. One of the key concerns has been AI's decision-making without human intervention, leading to potential errors in patient care. For example, a UK hospital's AI misdiagnosed a patient's condition due to data bias. Question number 2. Which of the following was a significant risk discovered in AI-based diagnostic tools? A, AI showing favoritism toward certain patient groups. B, AI refusing to give results. C, AI misinterpreting medical images. Or D, AI automating surgeries incorrectly. The correct response is C, AI misinterpreting medical imaging. The rationale. AI systems have been found to misinterpret scans or images, especially when training data are skewed toward certain demographics, resulting in incorrect diagnoses. 3. In 2020, an AI used by the US healthcare system showed bias towards which patient demographic? A, older adults. B, Asian American patients. C, female patients. Or D, African American patients. The correct response is D, African American patients. A study revealed that AI used in healthcare systems showed racial bias favoring white patients over African Americans for higher priority care. Question 4. Which is one potential ethical issue with AI in medicine? A, AI creating biased medical reports. B, AI administering medication without consent. C, AI replacing patient communication. D, AI causing fewer malpractice lawsuits. The correct response is A, AI creating biased medical reports. The rationale. Bias in AI data, especially in predictive algorithms, can result in biased medical reports that unfairly affect patient outcomes. Question number 5. What was a notable failure of IBM's Watson AI in cancer diagnosis? A, misidentifying cancer stages, B, suggesting dangerous patient treatments, C, failing to detect cancer in early stages, or D, not being able to process large data sets. The correct response is B, suggesting dangerous treatment plans. Rationale. IBM Watson was criticized for recommending unsafe treatments during clinical trials due to the limitation of its data inputs. Question 6. AI in medicine is considered creepy primarily due to which of the following reasons? A, lack of emotional intelligence, B, high cost, C, data privacy issues, D, decreased speed in decision making. The correct response is C, data privacy issues. The rationale. The use of sensitive patient data in AI system raises significant privacy concerns, as seen in DeepMind's controversial use of NHS patient data without proper consent. Number 7. How did a hospital AI system in the Netherlands compromise patient safety? A, by assigning random medication dosages. B, by overriding doctor recommendations. C, by misclassifying critical patient symptoms. D, by leaking patient records. The correct response is C, by misclassifying critical patient symptoms. Rationale. An AI system misclassifies serious patient symptoms as less urgent, leading to delayed treatments. Question 8. Which of the following is a risk when relying heavily on AI in healthcare? A, reduced healthcare cost. B, overdependence on technology. C, improved patient outcomes. D, enhanced doctor to patient communication. The correct response is B, overdependence on technology. The rationale. Over-reliance on AI could lead to overlooking important human judgment, especially in complex medical cases. Number 9, true or false? AI has been proven to completely eliminate errors in medical diagnoses. The response is false. Rationale. AI can assist in reducing errors, but it has also been found to contribute to new types of errors due to issues like data bias, and incomplete information. Question number 10, true or false? An AI system was used to predict hospital readmissions, but it falsely lowered care for some minority patients. The response, that is true. Rationale. Studies have shown that certain predictive algorithms used in healthcare underestimated the risk for minority patients, leading to decreased care quality. Question 11, true or false? DeepMind's AI was criticized for its invasive use of NHS patient data without proper consent. That is true. The rationale. DeepMind faced controversy for assessing patient data from the NHS without sufficient patient consent. 12, true or false? AI has been used to successfully reduce the amount of time it takes to analyze medical images in radiology departments. The response, true. Rationale. AI has been effective in reducing analysis times for medical images, although concerns about diagnostic accuracy still remain. 13. What was one of the major flaws in the AI-based tool used to determine kidney transplant eligibility? A, misjudging donor quality. B, bias against female patients. C, delaying high-risk patients' access to care. Or D, misidentifying blood types. The correct response is C, Delaying high-risk patients' access to care. The rationale. The tool delayed access to kidney transplants for certain high-risk patients, especially minorities, by misclassifying their risk levels. Question 14. Which major tech company's AI was found to show bias against female patients in healthcare predictions? A, Google, B, Apple, C, Microsoft, or D, Amazon? The correct response is B, Apple. The rationale. Apple's health app faced criticism for not including women's health features at its launch, showing the limitations of AI development without a diverse user base. Question 15. In what way has AI contributed to issues in the mental health sector? A, increasing the cost of therapy. B, replacing therapists in face-to-face interactions. C, misdiagnosing mental health conditions. Or D, inaccurately predicting patient suicide risk. The correct response is D, inaccurately predicting patient suicide risk. The rationale. Some AI systems have inaccurately predicted suicide risk, leading to inadequate intervention or unnecessary treatment. 16. True or false? In one case, an AI-assisted diagnostic tool misidentified a malignant tumor as benign, leading to a delayed cancer diagnosis. The response, true. Rationale, misdiagnosis by AI tools has been documented, particularly when the tool's algorithms isn't trained on a diverse range of cases. 17, true or false? The FDA has approved AI-based systems to independently diagnose certain medical conditions without human supervision. The correct response is false. Rationale. The FDA requires human oversight for AI systems in diagnosis to ensure patient safety and accuracy. Question number 18. In a real-world case, AI misinterpreted data about which kind of medical scan, leading to incorrect treatment. Is it A, MRI scans, B, CT scans, C, X-rays, or D, ultrasound scans? If you chose A, MRI scans, you are correct. The rationale. AI misinterpreted MRI scans due to poor quality data input, which led to incorrect treatments in several patients. 19. What is one key strategy healthcare workers can use to ensure AI systems are not biased in patient care? A, use AI without reviewing results. B, provide diverse training data for AI systems. C, replace human decision-making with AI. Or D, limit AI to administrative tasks only. If you chose B, you are correct. Provide diverse training data for AI systems. The rationale. One of the most effective ways to reduce AI bias is to ensure the system is trained on diverse, representative data sets. This helps in avoiding errors based on race, gender, or socioeconomic status. Question 20. How can healthcare workers maintain patient safety while using AI diagnostic tools? A, rely solely on AI from complex diagnoses. B, only use AI for minor conditions. C, avoiding using AI for high-risk patients. D, use AI tools as a complement to their clinical judgment. If you selected D, you are absolutely correct. Use AI tools as a complement to their clinical judgment. The rationale: AI should be used as a support system, with healthcare workers applying their professional judgment to verify AI recommendations before making treatment decisions. Our bonus question: what is one important step healthcare workers can take to improve AI integration into clinical practice? A, eliminate AI training for healthcare workers. B, advocate for ongoing AI education and training. C, completely depend on AI for patient assessments. D, limit AI to non-clinical staff. The correct response is B, advocate for ongoing AI education and training. The rationale: continuous AI education and training for healthcare workers ensure that they stay updated on how to best use AI systems and understand their limitations, promoting safer and more effective care. Thank you for making AI less scarier for all. As a healthcare provider, we are going to be using new technology. AI is going to assist us in numerous ways. However, we have to review what's in the patient's record. We have to review what's transcribed by the provider. And that's how we're going to actually help to keep our patients safe and to help decrease those medical errors. Share your thoughts. What did you learn, and how will this new knowledge impact the way that you provide care? And as always, we thank you for your support. Thank you for making AI less scarier and less creepier in the healthcare field. This is Nurse Eunice wishing you all a good night, and I'll see you in the next video.